Hello, I'm Umair Khalid. I'm one of the social media editors at JACC Cardiovascular Interventions, and it is my great pleasure to welcome Dr. Park from Asan Medical Center in Korea. Good morning, Dr. Park. Thank you for joining us today.
Thank you for having me. I'm very honored to participate in this interview.
Of course. So we're very excited to feature your manuscript titled Frequency, Predictors, and Clinical Impact of Valvular and Perivalvular Thrombus after transcatheter aortic valve replacement in our social media section. So Dr. Park, could you kindly begin by summarizing the objectives of the study?
Yes, so our study was pre-specified analysis from the TAVR trial in the last year presented the ACC 2022 rate-breaking trial and published in the circulation. And this is a pre-specified subgroup analysis. Our study purpose in this manuscript, we evaluated the overall prevalence of the leaflet thrombosis as well as perivalvular thrombosis. And then we try to find the risk factor associated thrombus, perivalvular thrombosis, and then the potential clinical impact associated cerebral thromboembolism.
Thank you. Thank you for your answer, Dr. Park. So on that note, if you could describe the results and if you could briefly mention some of the independent predictors of the thrombus post-TAVR, because this is an entity that we're seeing more and more every year, and people are talking more about it, and the management is still, a question mark currently.
Yeah, absolutely. This is the overall the population receiving TAVR procedure going up. That especially in the low risk population is going up, and some of the series of clinical trial and the show the result is the different antithrombotic strategy. But however, still leaflet thrombosis as well as perivalvular thrombosis is not rare, very common. It's based on CT scanning. And so our trial is provide some insight about the clinical impact, overall prevalence, and the risk factor as well.
Thank you, Dr. Park. If I may ask on that note, in patients who had the thrombus post-TAVR, did the thrombus correlate with the gradients also on the echocardiogram?
So, and there was as additional sub-studies published in the Heart Journal, and
right.
Regarding the presence or absence of the thrombus and the leaflet thrombosis as well as perivalvular thrombosis, it does not impact any hemodynamics at the 6 months follow-up serial echocardiography.
Perfect. No, that's a very important question. So thank you for clarifying on that note. And lastly, how do you think the results of your study can help us in clinical practice? And in future, what studies do you think are needed on this topic?
Yeah, absolutely. Our study had some key points, and the first one is overall prevalence of the perivalvular thrombosis, aortic valve complex thrombosis, that is including leaflet thrombosis as well as perivalvular area thrombosis. Overall, approximately more than 40% in the half of patients that have a chance to perivalvular thrombosis. In clinical viewpoint, and in our TAVR trial, we did serial the MRI scan and the neurologic functional test. The presence of perivalvular thrombosis did not, absolutely was not associated with any high instance of cerebral thromboembolism detected in the MRI and the neurocognitive function test. That means in clinical viewpoint, and although the prevalence of perivalvular thrombosis is high using 3D CT scan, clinical impact is not remarkable, it's minimal. So, and our trial in clinical viewpoint, and according to the CT finding, do not dictate any antithrombotic regimen. Our trial is support current guideline recommendation. In patient without OH indication, aspirin alone would be okay. The inpatient with OH indication, DOAC would be okay.
Thank you, Dr. Park. And that actually really helps us out, because at one point, it's very scary to look at the burden of the thrombus after TAVR, but at the same time, it's also good to hear that clinically, from a neurologic standpoint, may not be as clinically impactful. So, but thank you, for Dr. Park, for sharing all these insights, and congratulations on your work.
Thank you. Thank you for having me.